Hi everyone, we're going to introduce the 5-year corporate strategy plan of Elevance Health. Elevance Health, previously called Anthem, is a leading health company dedicated to improving lives and communities and making healthcare simpler. Through its affiliates, Anthem serves more than 118 million people, including 45 million in its family of health plans. According to the official annual report, the total revenue of Elevance Health in 2022 is $138 billion, which increases 11% from $122 billion in 2020. Dividends per share increased to 4.5 in 2021 from 3.2 in 2019. The company's current price to earning ratio is about 17.7, which means that the company has a strong profitability. The company has the steadily increasing cash flow over the past few years. In 2021, they managed to achieve revenues of $156 billion, which eliminates any risk of equity dilution. Management is making it a priority to give back to stakeholders through dividends. In the long run, I think investors will continue to focus on how cash flow increases, as this will be a direct reflection of the potential return to investors. The mission of the company is to make healthcare more affordable, more efficient, and more accessible for everyone.
To date, more and more members have joined, and the total number of the members now stands at 47.3 million. The primary business is to provide wellness programs and integrated care to improve living communities and simplifying healthcare. From a business perspective, Elevance needs to focus on maintaining their customer base and providing their customers with high-quality products to increase user adherence. At the same time, it is necessary to attract more people into their own customers. Elevance Health has the opportunity to capture more market share, increase the scale of business, and become an industry leader. Based on this vision, the company should absolutely expand their presence in the geographic market and introduce new products to attract customers. Elevance Health has recently issued a press release claiming that their affiliated health plans will expand to offer products including vision, hearing, dental, and other wellness services to 2.1 million healthcare eligible customers in 145 new counties, and will add PPO plans in 210 counties. Because the company already has great regional coverage and has sufficient market knowledge of their covered customers, geographic expansion to these new counties would be feasible. Another way to increase scale is to enter markets with different products. When launching new businesses, the vertical integration of the company is strengthened and the businesses of its subsidiaries are regulated, such as Anthem for Medicare and WellSpoint for evaluating healthcare. The overall financial position of the company is good, which lays the foundation for the development of new products. And the general environment of COVID, where people are generally out of money, tend to prefer more personalized plan, which makes the product's expansion in the market possible. Elevance Health survey results suggest that new products could be telemedicine, and people's attitudes towards virtual healthcare is possible. Elevance Health has a basic digital platform. People have become familiar with telemedicine after COVID, and the market size continues to rise, with a lot of room for growth.
Now we'll briefly review the corporate structure of Elevance Health and their current subsidiaries. Elevance operates as a conglomerate, where they are more focused on subsidiary acquisition and implement contractual vertical integration as part of their corporate strategy. They have three wing brands that operate with partial independence: Anthem BC/Anthem BC&BS, WellPoint, and Carelon, which we will discuss further later. Currently, Elevance is increasing their presence in the insurance markets and building stronger, non-regulated vertical integration while partnering with other companies, such as BC&BS of Louisiana earlier this year, and acquiring their subsidiaries in the health plans and building their brand name as Elevance Health. Here on the right is a list of their current main subsidiaries.
Here's Elevance Health Board of Directors and main senior leadership. Mr. Skell Baudreau is the current CEO. A relatively new position that was added to the senior leadership in 2020 was the Chief Health Officer. Mr. Agarwal, who has a background in both nonprofit and CMS, is responsible for developing community health strategy that better complies with and predict governmental regulations for the next 5 years. When it comes to corporate strategy for the next 5 years, the objective for Elevance Health to achieve by 2028 is successfully build a user-friendly and comprehensive service for customers, and further outreach to customers through geographic and new product expansion in order to construct a sustainable whole health ecosystem. How Elevance Health get there is to organize the brand portfolio into 3 wings, including the Anthem BC or Anthem BCBS. Another is WellPoint. The third one is Carelon, to raise brand recognition. And Elevance Health should expand the breadth and depth for each core brand. To do that is to ensure the legal accountability. For example, Elevance Health to contract with a third-party corporate regulator to compete the investigation result with its internal regulator to drive performance.
To monitor the performance of these strategies, Elevance may look at the total number of health plan members, survey patient care experience and outcomes such as mortality and morbidity rates, and review annual medical and resource costs. Elevance Health's goals for their network strategy are to build the brand of the plan product and the plan itself. As mentioned before in their corporate structure, Elevance implements contractual vertical integration, in which they are contracted with their beneficiary states through private Medicaid plans. We recommend that they use a combination of HMO and PPO plans to balance the pros and cons of these types of plans to attract more consumers who can pay lower monthly premiums and be covered for some out-of-network primary care physicians without being stuck to a physician from a preferred network. Both Elevance's Medicare and Medicaid plans should also have a contracted network to build financial incentives for their physicians to raise healthcare quality and competition within the marketplace.
There are some risks for Elevance Health to address and prevent for the next 5 years, as its telemedicine growth and expanding subsidiaries under the core 3 wings. Patient privacy leak is a critical issue to prevent. Elevance Health should ensure employee security training by restricting allowable devices access to their database and raise accountability with severe sanctions. For Inflation Reduction Act passed in 2022, Elevance Health should redesign Medicare Part D to correspond with the act, since government will post stricter prescription drug price over time in this area. An idea for Elevance Health to replenish its lost revenue from this part is to promote the acupuncture therapy, which is a whole health medical care, as a drug replacement.
A third risk that may result from vertical integration is a lack of consumer choice, which may result from Elevance gaining a larger insurance market share and reducing competition, thus limiting consumers and leading to diseconomies of scale and increased costs. To conclude, here are our key takeaways from our proposed 5-year plan. We recommend expanding their geographic market presence and product market in telemedicine, continuing to build their brand name as Elevance Health, addressing the short-term and long-term risks of our corporate and network strategies, working around regulations such as the Inflation Reduction Act, and strengthening non-regulated vertical integration throughout their network. Thank you for listening to our presentation.
Thank you.